All right, ladies and gentlemen, my name is Samuel Asamoah Boateng. I'm a nurse in the US of A. And I practice in Pennsylvania in a magnet hospital. I work in a cardiovascular unit currently. I have a background in palliative care and other places. My aim today is to allay all the test-taking anxieties regarding pharmacology. I'm going to try my best and give it to you as you're supposed to take it. It will not be the usual classroom pharmacology experience. Everything you are having here is simplified and it's easy to grab. When you have knowledge genuinely to share with us, please do. Do not share it just so you appear intelligent among us. I, your facilitator, am a clear example of an average student. I've never won any academic award. I've never been the first or top of my class before, ever in my life. I am that type of student somebody wouldn't say, oh, he's not extremely brilliant, but he's not dull too. That type, a clear definition of who an average student is, just slightly above average. If you have anything to share, share. Also, this class is for you if you really find it difficult understanding things. Said that when I'm moving forward, feel free, bring me back. It's a free class. None of them can hold you responsible. You don't even know them. Forget them. Bring me back. Make sure that you understand it. But with my little experience in teaching and my psychology, I can detect who was paying attention and who was not. And I have ways of detecting that. I'll ask you a simple question. So be very careful not to intentionally drag the class back anyhow. Apart from that, we are good. We are free to go. We'll be joking and making fun a lot. We want to go and write the NCLEX. So I decided to study. Those days, that was somewhere in 2022. I was not preparing for NCLEX, but there were people, co-hosts, please mute those who come in, who leave their mics unattended to, please. Thank you. So I was attending to some students who have recognized that I could lead group studies, and they say, Asabi, we are going to write international exams, so we want you to lead us. And then they asked me to prepare some of these slides. So with this particular slide on cardiovascular pharmacology, this is what I did. And even as I teach, you will see that I teach you how to also teach. Okay? One of the best ways of learning is to teach it. So I look at, when we talk about in fact, the causes of heart conditions in general, because if we know the cause, or even if we know the progression of the disease, then probably that is when the drug will come in to stop it or halt it. So I really have to grab or have a fair understanding of the causation of the disease. So I sat down and then I did my own search about what will cause a heart disease or cardiovascular illness. I realized that age, as you age, your age is not the same as when you were young. So it was a factor: smoking, hypertension, obesity, family history, diabetes, atherosclerosis, sedentary lifestyle, and high cholesterol. If you're a nurse here, I believe these things are familiar. This is not the time to learn it per se. But the aha moment for me was one particular thing: hypertension itself. Trying to see what causes heart disease, and they are saying hypertension causes heart disease. But hypertension is in itself a heart disease. So, see, I actually cross-checked it. I cross-checked it against coronary artery diseases. And I realized that these same risk factors, including hypertension, was there. They worked. So I created a mnemonic for it. I call it the ASH of DASH. ASHO. Like this type of mnemonic was very useful when we were writing the basic nursing exam, the one that you have to write or type things by yourself. But these days it's a computer exam, so you just click. So whilst this can come in an exams like a simple question about a heart condition, and then they ask you about the risk factors, this is something that you can actually choose. Any of the ASH of that works. But importantly, the hypertension, which is something that has kind of intrigued me the most. But just as a quick recap, you see, those of you who have forgotten how blood flows through the heart, even if you don't understand it and you want me to take you through privately, I will try and make it easy for you. Now, the concept is this: blood from your upper part of body will enter the heart through the superior vena cava, and that from the lower part will enter the heart through the inferior vena cava. Inferior down, superior up. Vena cava is a vein, a big one. So it enters the right part of the heart, the right atrium, through a tricuspid valve. Then it enters the pulmonary artery. There's actually a pulmonary valve there. It goes into the lungs. Then the blood at that time takes oxygen. It comes back through the pulmonary veins. Because vein, French nika say vein come, artery, alley, go. Okay, so arteries take blood away from the heart. That's why the pulmonary artery took it away from the heart to the lungs. But when it's coming back to the to the heart, that is vein come. So it will enter the heart through a vein, okay, the pulmonary vein. Then it will go to the left atrium through a valve called the bicuspid or mitral valve into the left ventricle, then it through the aorta into circulation. This is just a recap. We are not teaching it. Mind you, this is a pharmacology class. So this is how just the blood will flow through to every part of the body in just a second. I've done that. Just a recap. If you don't really understand the flow, please, I'm available, not 247, but I'll try my best to meet you privately and take you through it free of charge. I wouldn't take anything. Now, you could see from my image that it's pumping. Okay, here it contracts and relax. It contracts and relax. There is another aspect of the heart that beats, pulsates. Whilst it's contracting and relaxing, it's also beating up and down. Dab, 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 dab. You know? So that issue with it, that ability of the heart, when it squeezes things up, even with the tube that it is going to pass through, the vessels that it will pass through, we are able to ascertain something we call blood pressure. If you go to the books, they have their critical definitions and all that. But to be honest with you, every nurse as it stands now know what we talk about when we are talking about blood pressure. It is what we get when we tie the signal manometer around your arm and then we inflate it, the numbers that come. Sometimes two numbers will come, the systolic and the diastolic. If we are to go deep into that, we'll see one is mostly about the contraction and the other about the relaxation, but there's more techniques to it. So the BP, if they want to go deeper, they will tell you that it's the cardiac output times the systemic vascular resistance. When they are talking about resistance, they are just talking about how free your blood vessels are. They are saying that if your blood vessels are open, blood will flow through easily. But if there is a plague, a fatty plague like we are having on this image in there, let me change the color of my marker to red. If you are having this in here, like that, it narrows it. If you want to understand this phenomenon well, take a water hose, the tube that we used in washing car or anything, then pinch the mouth, pinch the mouth like that. You will see that the water will try coming up with a pressure or a force. So that is how blood pressure is also determined. We all know blood pressure. But what I wanted to draw your attention to before we go into pharmacology is this. Did you guys realize that hypertension itself is a cause of heart disease? Did you see that?
Yes, sir. Yeah.
Yeah.
Yes.
So it means that if we are really able to understand the drugs that will treat hypertension, we will prevent loss of heart diseases. So don't you think so?
Yes.
Yes. So let's start with drugs tackling the hypertension, and let's see if it is true that it will be the gateway to all other cardiovascular conditions. In fact, in short, the anti-hypertensive. I'm saying anti because guys, I'm assimilating. When I was in Ghana, I say anti, and then I sort intimika anti. That is how they say it in the US. Yeah, I mean, whether anti or anti, these medications are simply drugs that are going to relax the heart, nothing more. Anything, whether it is beating, whether it is contracting, just relax. So all that these drugs are going to do is to relax you. And so they are going to calm the heart. But if you want to be technical, you will say, oh, it will drop the force of contraction and the rate at which your heart is beating. That is your pulse. Now, as a general principle, before you administer any of these drugs that we are about to talk about, you have to make sure you check the person's BP and pulse. As far as antihypertensives are concerned, the blood pressure and the person's pulse rate. The question is, at which BP? Let's take the BP comes with two numbers, systolic and diastolic. So my question to the class, at which systolic are you not going to give a blood pressure medication?
Yeah. So below 90 or below 100 for
Okay.
systolic.
Okay, any other?
120.
Below 120, below 100. Yes, any other?
100.
500. Well, that's
90
surprising.
and below.
90 and below.
Below
Below
100.
100.
All right.
Below.
I heard some bass voice below 100. That voice missed it. So I will take the male voice, please. In my non-Nigerian movie that I watched, the God that was creating things said, let there be Lord. That deep voice, I mean, it does a lot for me.
Asabi, I'll stop talking in your class. Honestly, I'll stop
Please,
talking in your
please,
class.
please talk for me. I like it. All right. So I would pick the 100. Guys, the NCLEX accept that when the blood pressure is 100 or less, if it is exactly 100, confirm with the doctor. If it is below 100, the systolic, if it is below 100, don't give the drug. Hold it. I say if it is below 100, what?
Hold it.
Do not give the drug.
It's a question on the NCLEX, so please don't joke with it. And then what about the diastolic?
60.
Any other?
Yeah.
I think we will look at 60. 60 is okay. I'll accept it. What about the pulse? When wouldn't you go ahead and give the drug if the pulse is something? What number?
Less than 60.
Below 60.
Okay. If it's a consensus, then we will take it because everybody's saying 60. So we are going to use the 60. Now, if you want to give any antihypertensive, please, we are going to learn about the contraindications as we move forward. But as a general principle, make sure the person you are going to give it to has no contraindication to it. If the person has a slightest form of contraindication, don't give it. And it will be an answer on the NCLEX. Then we see that sometimes you see drug, they've written SL, something, something L, something, something L. Some of them are sustained release, some extended release, whatever. As a principle, when you see XL, extended release, it means that that medication should actually be swallowed whole. Guys, please understand. Oh, you don't chew it, you don't crush it. I don't care which medication that drug is, but it's a trick. We don't have time to learn every drug in the world. But at least knowing that if it is tagged SL, I know that that drug has to be taken swallowed whole because it's supposed to kind of bypass the intestinal harshness or something, or the stomach harshness, acidity, or whatever, before it gradually now release into the system. I know you've heard about lots of antihypertensive, alpha blockers, angiotensin converting enzyme inhibitors, beta blockers. Somebody's writing on the screen. Calcium channel blockers, centrally acting, and etc. In fact, there is a long list to this, and we will be adding on to the list as we move forward. So, if I ask people, mostly people have fair ideas and knowledge about beta blockers, calcium. They will tell you, they know them directly, they will tell them. But one particular drug that has been troublesome is the alpha blockers. In fact, when you look at the full name is alpha adrenergic blockers. My question, what does the adrenergic in alpha adrenergic blockers mean?
Works on the adrenaline.
It means adrenaline. It's as simple as that. It means adrenaline. So alpha adrenergic blockers, the adrenergic is talking about adrenaline. Okay. Now, adrenaline, what is it? In fact, we have a whole gland in the body called adrenal. When you take your time to separate the word, you see that it is renal, the renal gland, the kidneys that we are talking about, and something has been added to it in literal language, just making fun. But it's true. It has been attached to the kidneys or to the renal system. So it's adrenal. In fact, when you look at the adrenal gland, we have the cortex, which is the outer part, and then we have the medulla. My teacher said medulla, so I still use medulla for now, which is the inside part. We are not doing that anatomy today, but the wisdom is that whilst the outer part produce the steroids, okay, the mineralocorticoids, glucocorticoids, and then the androgen, the inside part will produce the catecholamines. I mean, what is inside the adrenal gland, adrenaline. So it produces adrenaline, adrenaline, right? So we are talking about adrenaline, which is coming from the adrenal gland. In fact, the adrenal gland is responsible for our fight or flight. I remember I was able to be a nurse without understanding this, but it was possible for me to still pass my exams and be a nurse. In fact, when we are walking and then we see a lion approaching us, something will happen to our body. Whatever will happen to our body is what adrenaline or the adrenal gland is doing. So in terms of stress, adrenaline will be released into the system. So that is all that we are about to talk about as it stands now. I just wanted to give you an idea of what the drug is. Now, in fact, when adrenaline is released into the system, there are so many receptors, places that will receive him. And for every place that adrenaline is received, they have a particular behavior that they kind of produce or exerts. We have some of the receptors called alpha receptors. Some are beta receptors. I've not heard of Charlie, but I believe there should be Charlie receptors, delta receptors, echo receptors, and so on and so forth. Now, when we come to our discuss right now, we are going to deal with the alpha receptors. I hope you are following. I trust you. I know you sleep, but today your eyes are open like something. And for alpha receptors, the note is telling me that we have two main types. But in fact, in a pharmacology class or proper pharmacy class, you see there's a lot of them. But for us as nurses and for now, we are going to take the assumption that we have alpha 1 and alpha 2. In fact, I wouldn't want us to talk so much about the alpha 2 because the little that I've observed is that alpha 2 is mostly in the brain, central nervous system. So we will leave that another time, but concentrate on the alpha 1. And even if you look on the screen, you will see that with the alpha 1, we have alpha 1A, alpha 1B, a lot of them. But the whole wisdom is when adrenaline comes to the alpha receptors, the usual expression is that it does something. It does something. And what is going to happen is that it causes smooth muscles to contract. Now look at the guy's muscle. They are saying that is smooth. Me, I don't see any smoothness here. One muscle here rough. Guys, what can you see inside the guy's muscles?
Veins.
Good. So if these muscles contract, what will happen to the veins too? They will what?
Contract with it.
They will contract with it or they will constrict. It's just English, right? So when this guy, the way he's built as if he's strong, I doubt he's strong, but the bodies are just so. When a lion should come with, she's working with the woman and then the lion comes in the middle of the night, adrenaline will be released. What the note is telling us that if this adrenaline gets to the alpha receptors in the smooth muscles, they will contract. And then when they contract, obviously, the vessels in them will constrict. This is our assumption of what will happen to the vessels, but we are right. Now, even with I mentioned smooth muscles. So, Asabi, where can we find some of these smooth muscles? Well, we're going to learn about just 3 of them so that we don't kill ourselves. We have rightly seen that. Please, somebody mute Betty's mic for me. Okay, thank you. Yes, so what has happened is that we have one in the vessels. There's some smooth muscle around the vessels. Mostly when you look at your hand, if you are not too fatty like me, you see a vein there. Me, I have a lot of fat, so I don't see them, but you will see yours. Then you see that we can also find them sometimes around the bladder. They say the bladder neck. My image is not that good, but please, can you see the bladder neck I'm talking about?
Please, yes, yeah.
Yeah, so that is the bladder neck. It's also having smooth muscles. And then they are saying they have another type. So we have the alpha 1A, which mostly around the prostate and bladder neck, around this area. And then when adrenaline gets to the smooth muscles there, obviously it will also constrict or contract. So it makes the bladder stiff. that kind of thing. And then we have the blood vessels one that we are talking about, which is the vasoconstriction. Okay. And then they are telling us about a new type. They say it's mostly also in the bladder. And then some other vessels. To be honest with you, as an average student, I can't take many things at a time. And we will leave it with the blood vessels and bladder. Now, let me small. So we will take it there. Now, you see that the blood vessels is creating something we call systemic vascular resistance or peripheral resistance. When the vessels are narrowed or closed, do you think the heart will work harder or will work slower?
It will work
To work
harder.
harder.
So
To work harder.
in terms of blood pressure, when the blood vessels are constricted, what will happen to the blood pressure?
It will
High.
be
Your
To be
question
high.
increase.
So you need more force to push the blood through it, right? It will be high.
Yeah.
So imagine we just understood that there is a disease called hypertension. In fact, if a person is having hypertension, I'm just asking a simple question. Though this is a normal phenomenon, and this adrenaline, me like this, each time I see a woman who has a front like this, my heart begins to like adrenaline. I don't know how many grams of adrenaline is poured from my adrenal gland. Then my eyes, something is happening. Something has just happened to me. Okay. So with a person who is having hypertension, do you think we should allow this normal process to go on?
no.
We can do something about it, right?
So,
Yes.
So normally when I come to class, I pick somebody who is joining my class, a female with a very good network who is joining my class for the first time, and I make the person make a pledge to me. Is there any female here who is joining the class for the first time and want a special treatment?
Yes.
Obapa.
Please.
Okay, Obapa, you were loud and clear. Let me teach you something. You see enzymes and hormones in the body, eh? Obapa, are you with me?
Yes, please.
Uh-huh. You and I are going to make an agreement. We wouldn't harm them, okay?
Yes, please. I'm
Enzymes
new
and
here today.
hey, the network now, okay. Can you hear me?
Yes, please.
Okay, yeah. I know you are new here. We are going to make an agreement. I'm making an agreement with you that we are not going to harm any enzyme or hormone in the body. Okay?
Okay, sir.
Good. Please, like, always put it at the back of your mind, though. We wouldn't harm any of them. Okay. So, based on that, instead of harming adrenaline, which has been released from the adrenal gland, we understand that it is alpha receptors, as it stands now, that when they receive adrenaline, causes the smooth muscles to contract. But if we say we are stopping adrenaline, it's not only alpha receptors that can receive adrenaline. The other, so we wouldn't bother adrenaline. Let adrenaline come, no problem. But the receptor site, where we have the smooth muscles, let us block them. Okay, said that even if adrenaline comes around, Krana, he will not identify them. In my culture,
So
it's
if
a gut.
somebody's writing, the person should just stop.
Yeah, I think I was doing that. Yeah, thank you for
Wow.
looking for. So in my culture, what happens is that when they are kind of receiving a bride, okay, they cover the first person that they are bringing you, the man, no, they intentionally cover her with the veil. It's like they give you a decoy. They trick you. It's not your wife. That kind of thing. That's what we are doing with the smooth muscle cells right now. So we are going to block the receptor site, and then we are going to call the name of the drug that is going to do that, alpha blockers. Or if you really want to understand how the name works, it will be alpha receptor blockers. Somebody says it's blocking what? Okay, then let's make it a very full name. Alpha adrenergic receptor blocker. Right? Guys, do you understand and agree? Do you agree?
Yes, we
Yes,
do.
sir.
Yeah, but the show screen here. Last one, Mubusa, I said, Dakasem Yana May. You rough me no park room.
Yeah, ready.
What was so true? Once a moon so watch a greater than and I say X design. All right. Buddy, please be careful because they will remove you and you can't join the Zoom again. Please. I have very dangerous admins. Don't try them. Udim tia. Kabijai. So for the alpha blockers, we are going to give it to a person whom we think is probably having hypertension, and we don't want adrenaline to further work on the smooth muscles to contract them. Because a simple question, guys, what happens to smooth muscles when they receive adrenaline?
They constrict.
They contract.
And then what happens to the vessels in that smooth vessels?
They constrict.
Contract also.
Does that mean that if we block the receptor site, the vessels will remain dilated?
Yes.
Yes. Okay, so we
Yes.
can get vasodilation. Then remember that as part of when we were learning where we can find the smooth muscles, somewhere around the bladder, we could find some. True or false?
True.
So people with bladder issues can sometimes be given alpha receptor blockers. True or false?
True.
Yeah, like for example, people who have benign prostate hyperplasia, it's a non-cancerous enlargement of the prostate gland in men. So this drug will help relaxing the smooth muscle because already that prostate enlargement is pressing on the bladder already. So if we give it, then the smooth muscles will not receive adrenaline. It will relax it a little bit. So at least we know that for hypertension and benign prostate hyperplasia, BPH, we will use alpha blockers. Now this is where it even gets dangerous. There is this guy,
Terry Bonchaka.
Terry Bonchaka, Terence Ni Okai Mensa Ajete. He was the first grandson of a parliament speaker, a speaker of parliament. His name was Peter Alajete. I mean, this is a Ghanaian thing. And usually those people, what I call, is it the egalitarians or whatever, they normally don't make their kids or grandpeople go into this. But this guy, he was the very first one to do hip life music in Ghana. He was very energetic. It's not easy. He was very, very energetic. Let me see. Today, for the purposes of time, I will do the singing. I'm not going to the YouTube page. You see that the YouTube, sometimes I go to the YouTube page and people forget themselves that we are even in class. Students will be dancing. In fact, I won't go there. He can even, when he comes to stage, he has a different kind of energy. Those who lived enough to see him, live enough, say. He can pick one of his legs and be dancing on it continuous for 10 minutes without getting tired. Poo. He was very strong, very energetic. And I could imagine the sort of adrenaline this guy had in him when he performed. He hardly even picked dancers with him because he himself was going to do the dance. He sings and he responds. Then he has this song that I don't even understand. But the endings of that song did something for me. It goes like a military cadence. Like he rattles some lines. Then they respond. Zoze. 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 Then the chorus will be like Shreme, Shreme, Shreme. The feeling of the Zoze. So when I look at the adrenaline this guy was using to perform the song and it was rhyming with the zozi, it will interest you to know that the alpha receptor blockers, they are all ending with zosin. Yes. So we have terazozin. Just take my name, asabizozin. Anybody you know and azozin, and that person becomes an alpha blocker. That is it. Don't go and kill yourself on the exam. So, but if you want to be technical, for those who know book, no, if this is not simplified enough and you want us to go deep, most of them will be zosin, and the other one is ozin. Then you getting stronger, ozin.
You are amazing.
Ozin. Have you heard a song like that before? Ozana getting nearer. Ozin. They are all. So when a question comes, now which condition will be used in which condition is tamsulosin used in treating? And then as part of the answers, you see, the answer just comes like she said. It's BPH. You don't even struggle. Tanya hypertension a bad day.
BPH.
BPH.
Yeah.
BPH, because that is where the smooth muscle is. So that is the ideology. That's all to it. All right. So going a little bit further, just so that people will understand. But this one, I don't even need to do it. Me, the NCLEX know that it is zosin, and ever since we started teaching, it has been zosin. Treme. Oh man, oh man,
Feeling of the zone.
yeah, zosin. Zosin, yeah, yo. Yeah, me dia broko na wo. So there was this one called the Selective. The reason why we are calling them Selective is that they are working specifically on the bladder and other stuff and not targeting the vessels. And those will be the zosin. Okay. Sorry, the non-Selective is what I'm talking about. The non-Selective will work on the vessels and then some little part of the bladder, not really on the urinary system. But those that will work specifically on the urinary system, they will have the U or Z in them. So like tamsulosin, you could see that they have the U here, right? Gershon, please kindly control your mic for us. Okay. But guys, you know what? Don't worry about it. The fact that it is ending in what? Losing is an alpha blocker, and the NCLEX won't take you further. What I have here is deeper, so that in case your husband is a pharmacist and he or she decided to join, your wife is also that, and then just look at how I'm teaching and recommend me for me to teach you. She will know that I have the real thing, but I'm just using tricks to make learning easy for you. Now, we also have one we call the non-selective alpha blockers. They will do even the alpha 2, which I talk about, the central nervous system activities. So those wouldn't have the usual names that you know. The NCLEX so far have not disappointed me by bringing them on any of my students' exams, because if they had, my students would have pointed out for me. Those are working on the brain and some other central nervous system issues. Stimulate you in that. So they don't have the ozin, but they are also alpha blockers. But specifically, they are non-selective alpha blockers. ABAB. That means they work on alpha 1 and alpha 2. Example is phenethylamine and then phenozibenzamine. Don't kill yourself. I repeat, don't even forget that we learned them today. Just for bragging right. Maybe you go to the hospital and the doctor is talking and you behave like, oh, I know them. Oh, is it not the alpha 2? Oh, I know them. Just to be big a crayon or bar. You see, when you come to America, you see their eyelashes. Or baby eyelash bit more page what work on it. That kind of confidence is what I want to give you. You see. Now, there is a particular group in Ghana. I'm sorry if you're from Nigeria, but I love you so much. Just want you to know what is going on in Ghana. This guy is not behaving like TB Joshua. No, that starts with a T. TB is tuberculosis. No, not that dangerous. No. This guy, I'm not speaking as a Christian here. Please don't come and attack me in future. He thinks that there is a particular time and hour God operates. And this particular time is around 12 p.m. in Ghana time. Or what? Is it 12 a.m. or 12 p.m.? Which is which?
12 a.m.
You see, they know him. They know him. And what does he call that time?
Alpha.
He calls it Alpha R, with a lot of people joining to pray, including pregnant women who should have adequate rest, including people who doctor have requested, please ensure adequate sleep. You will pray. So, and then when I joined him the other time, he was like, I want you to use, the guy was speaking calmly. I want you to pick the bottle of water and I want you to use it as a point of contact. So guys, I stole that English. I also want you to use this alpha blockers as a point of contact to all other antihypertensives. Are you with me? We can't go through textbook learning. Our head will burst.
Yeah.
So we are going to use that with the side effect. So for the side effect of all other antihypertensives, we will use this one as this building block. The truth is that your blood pressure is up. We want to bring it down. And so in the course of trying to bring it down, we can achieve the opposite, which is 2 down, or what we call hypotension. Now, in fact, the time that we will get to know that you have hypotension is mostly sometimes when you get up at once, either from bed, like from lying to sitting, or from sitting to standing. Then you will tell us, I have some dizziness. Hey, I feel dizzy because of the distributive kind of pressures in there. When you wake up, the blood flows, and then there is a responsive type of tachycardia thing. So you feel a bit dizzy. Now, because of the posterior changes, the technical word we use is called orthostatic. So if you say go and check somebody for orthostatic pressures, it means you will check the person while sleeping, while sitting, and then while standing. Some people can even add walking to it. Those are orthostatic, positional, right? So your hypotension could exist. The reason is that we are not all the time checking your blood pressure unless you're in the ICU or have a cardiac monitor. But then, if you rise up and you are feeling that, we could recognize that as orthostatic hypotension. So that is the number one cardinal side effect of alpha blockers, which we are seeing we are using that for all antihypertensives. So on your NCLEX, you can choose that as an answer. Then I spoke about dizziness. It's the same as drowsiness. Somebody can also interpret that as fatigue. Yes, this drug can make you feel like you are tired because it's relaxing you. So it will create that phenomenon for you to relax. In fact, on the NCLEX, headache is a very good answer. And so when you've taken all answers pertaining to signs and symptoms, please add headache. I don't know what in the world can cause headache. Everything, including you, your presence alone can cause somebody headache. Are you aware? All right. Then nausea. The fact that you're going to take a drug orally is, it's credit. If they give you an NCLEX question and it's said that the drug is to be taken orally, check nausea and vomiting. It's a good thing. As for the weight gain, it is not part of what I'm teaching. I don't know how it got there, but it is under alpha receptor blockers. I don't know, but it's working. And this is also true because a guy called Kevin Taylor, I don't know to call him a history bro or what, he took his time to talk about this alpha hour man, and he said he has gained weight. Some more, Kevin Taylor on you. But it's all good, all right? Now, with this wisdom, if I were an examiner to test you, you see I have a lot of things to test you now. The person can get orthostatic hypotension. So how do you advise them? Let's go.
Change position slowly.
Change position slowly. Whether from where?
From sleeping to sitting or sitting to standing.
Or lying.
From lying to sitting.
Okay. All right. Now, you see, if you are new to my class, you will hear the chorus answers, and sometimes you wouldn't like it. I like it. Excuse me. I like chaos. So forgive me for that. It's a training. In the olden days, I told my students in Sparta, people were allowed to make choices, yes or no. And so when you scream louder, we all know everybody is voting. It's not like I told them. Then people who are trained will be able to detect where the answer is going. That is how I'm trained. Sorry if it creates a nuisance, but I like it that way. I just want people to participate. Now, in terms of the timings, don't you think we should take it at night? Because if you look at it, during the day, between the day and the night time, what time do you think humans sleep?
During the night.
During the night.
And so the orthostatic hypotension, if you give it during the day, the person will be experiencing because you'll be sitting and standing a lot. Two of us.
True.
So the person will feel more of the orthostatic hypotension. So the NCLEX will trick you. The NCLEX want to know if you know the simple truth. It may not be in the textbook. The textbook will just say orthostatic hypotension. Then they will coin it. How will you train that person? What do you think will be a best time? Then you say alpha hour is the best time God operates. My God only operates in an alpha hour. Now I say me. Okay, all right. If you are here in class, please answer this question quickly. We are slide 20 of 125. Answer in the chat box, don't tell me. When I said we have slide 20 of 125, we also have 125 people in class, just so you know. I like the response, but 25 responses out of 125 is not enough for me.
Why am I not able to comment?
Really? Try it again. Give it a shot. Go to the chat box. And the one who is sitting on the fence not giving an answer. There is this thing I tell my student. Adults, remember 40% of what they heard. To get to a 60% for them to recall what they've learned, it must be what they saw. So if they saw it, then they recall about 60% of it. If you want adults to remember 80% to 100% of something, let them partake in it. When they do it, they wouldn't even suffer. The brain association is connected. That is why I am asking you to answer in the chat box. But the old child will say easy until answer will three more. Yeah, I mean, who cares? After all, what? Okay, all right. The answer obviously is the B. Let's answer this. Hello, somebody want to say something? Now
I was saying I just joined, but I have answered.
Oh, okay. Oh, okay. Well done. Check your network before it fails you.
Asabi.
Sir, yes, sir.
Okay. No. I wanted to ask about this non-Euro selective and the non-selective. Now, you mentioned that the non-selective works in the brain and the nervous system. And then the non-Euro selective, even from the name, it works outside
not necessarily. The first premise, not necessarily works in the brain per se. You see, sometimes when we say central nervous system, we all think of the brain, but the other things that help, that the spine too works there, right? And the spine, there is an aspect of it that coordinates with the bladder, true of us.
Right.
So we use central, but not necessarily structurally to the brain per se. But you continue, frame the question, just so you know.
Okay, so I want to know, like for what is the striking difference between the non-Euro-selective? I already know that the non-Euro-selective works outside the urinary system, that's the neck of the bladder and the prostate gland. Now, I just want to know what is the striking difference between the non-Euro-selective and then the non-selective alpha blockers. I know that the non-Euro works also in the blood vessels and the smooth muscles. Is that the only place they work? Just the striking difference. Sorry. Thank you.
Yes, I wish I knew the striking difference. And you guess what? Since, like, I just issued a disclaimer that we shouldn't worry about them. You feel me? The difference that I can, as an average student, is the little that I was able to give assistance now. But the concept is that the NCLEX is not even interested in you knowing the striking difference, and they're not going to ask you the question based on the difference and where they are working per se. But the trick of the Ozana getting nearer. That is what is important. Zosin. You just identify zosin. Know that it's an alpha blocker. Get the wisdom of what alpha blockers can do, right?
Yeah.
Yes, just get the wisdom of what they can do. What can they do? They can cause smooth muscle
to relax. Yeah. To relax.
Yes. So if you are talking about the drugs, the blockers, then the blockers will cause it to relax. But if you're talking about the natural mechanism, then it will cause, you know what I mean?
Contract,
Yeah. So when you get a principle and then a drug comes in and the name is not ozin, then you can't apply these principles to them. But if the name is ozin, you just apply the principle without knowing the striking difference, as my good brother is asking, right? And you will still be perfectly fine. What do you think?
Yeah. Thank you. I agree with you. Thank you.
Yes, let's move forward. Otherwise, those who don't like there was a woman, a military woman in my class a time ago. At that time, I was a sergeant and she was a warrant officer class 1, 2 steps ahead of me. She came to my class. She said, hey, go straight, jump from the pathophysiology and go. I say, yes, ma'am. Then I move away from the pathophysiology. Then after class, you say, hey, you when we're teaching, why do you we want the eba. The eba in my language means what is coming. Don't waste time with the other things. And so I decided to have a bespoke class with her. She passed, and it was a good thing. I'll share with you later. But I will see. But to be honest with you, I don't really know the other striking difference apart from the little that I had. Okay, that's the honest truth. All right, I saw so many answers, and the answer was C. Let's try this quickly. Please, I'm taking the first 5 answers. Be part of it. Let's go. Beatrice Jampo, when you scar, mammy biddy, men train we are saying yet more info. I don't know what is that.
Oh,
Oh, me the jammy, just cabay. Scabay.
Oh, me evaluation is still na go do evaluation company ne intend my relaxer. So I'm still waiting.
And
But
what
then
is
school
a
no.
bomb in some bomb paya? But the sura kikadro ne suru wisa.
It is a year, I remember was something. All right.
Me feel some me discount.
Right.
Yeah, Betty.
Sabi, I want the question for now.
Betty, your voice
Asa
in
me
a
pata me pata me say all kasa no meyi na free ho. Asabi, would my question now kasa ye be you we free so.
Matia,
I'm ready.
I person.
Okay, we have 49 answers. We are good to go. Sometimes, the other time I explained to Angelica that it's sometimes also deliberate. Work under confusion, let me see, because the day a lot of you will be anxious, true or false.
And now I'm used to
Concentrating will be difficult, true or false.
True.
True.
If you answered correct, I like it. Thank you. It's all part of the training. Guys, is there any question on the alpha
Asabi,
blockers? Yes, dear.
yes, please. Please, I want to ask, why is it taken at night?
Were you
He just
No,
explained.
I was off. I'm sorry, please.
Okay, so
okay?
let me help you. He
Okay.
mentioned
Okay.
earlier that
Go ahead. Please
some of
help
the
her for me.
side effects of the medication is drowsiness, and you wouldn't want your client to feel drowsy during the day. So it's
Okay.
best taken at night.
Nice.
Thank you.
Okay. Thank you.
Yes. And that experience of the drowsiness the patient is telling you, we term it technically as orthostatic
Orthostatic
hypotension.
hypertension. Yeah.
Oh, yeah.
Excuse me.
Yeah.
I have a question too. In regards to the question we did before
Do you
this.
have money too? And will you share with me if you had money?
Sure, of course.
Okay, let's go.
Yeah, so I know the answer is to take in the night, but also I want to know, can you take it on an empty stomach? Do you have to eat before you take it in case they ask something like that?
So those cases come in ethical principles unless it's a specific drug that has contraindications with food. Alpha receptors, as we've known them, do not have any specific interactions with certain foods. However, as the class move ahead, I'll talk to you about grapefruit when we do calcium channel blockers. So it will be a trick for all antihypertensive that try to stay away from grapefruit when you take antihypertensive. But without us really going deep into the stories, I would advise that mostly drugs should be taken after food, or the concept we say with food. But it does not really have, as I know it as it stands now, don't really have any deeper relationship or correlation with that. And also, you asked something else, it might have escaped me about you said, though it's taken at night, and can we take it in the morning? Yes, you can. Pharmacists can give it to you in the morning. The wisdom is not about the night as in night. The wisdom is about you relaxing. Do we all agree that patients in the hospital mostly relax most of the time?
Yeah.
Yes,
So sometimes the pharmacist can even prescribe it in the morning. But on the NCLEX, we are looking at the ideal. In fact, I almost on daily basis administer this drug on the floor. And this is a cardiac flow. They should know better. They know, the pharmacists are even aware of it. If you try to challenge, they will mess you up. They will give you the pathophysiologist and you feel like you don't know. But they can give it anytime that they want. So the other aspect is about the principle of the goodness of the drug. Okay, if a patient even have a contraindication that if he takes the drug on an empty stomach, it's too dangerous. And then this person has an extreme blood pressure. And that is the only option that we have. I think people will do the ethical issue balance, right? Now, malfeasance versus beneficence and all those kind of stuff. It will also come in. But just this is all a philosophy to tell you, I don't know whether we will give it or not, we don't give it to. But I'm in front of over 130 people. What should I say? Smart because I mean format too. Put a format. What is it? All right, Philo. Putting it.
Yeah.
Let's go.
My question was because we choose that the patients the drug supposed to maybe around night. I was thinking of because the alpha blockers they relax the bladder or something. The patient would also be will be getting up to urinate and the orthostatic or something pressure or something also.
I know where you are heading towards.
Yeah.
Like if it's the bigger question would be, does it produce diuretic effects? Okay, and we have drugs for that. Diuretics, we will learn them. But this is just about the relaxation.
Okay.
And yes, there is a lot going to that. Even if the bladder relaxes, I don't think you need frequency sometimes. Sometimes when it's contrast, it even decreases the volume of the bladder. And if the bladder should have contained 500, now 400 crana Johnson, to meanwhile, so you can't even urinate. But when it relaxes, it feels better, right? Yeah. And of course, sometimes the relaxation could produce some sort of diuretic effect. So it could be a response, but necessarily that is not the mechanism of action. It could be slight of a side effect, but we don't really buy into that as a very huge thing. So, my dear, that is one aspect for you. Is it okay? Is it a little bit meeting you?
Yeah.
And so we are not giving it at 9 because of that thing. The whole wisdom is about the orthostatic hypotension. Okay. All right, guys, can we move forward now? Or is there any question? Last one.
Yes, sir. Last question. Thanks for your good work. I also read.
Which is cool. Papa, thanks you. When you thanks,
Okay. I saw a question.
Yes, sir.
From one cube. I'm talking about the color of the urine after taking tamsulosin.
Oh.
Yeah. And in that question, the answer was red or reddish orange. And I saw in this question the question you posted.
Yeah, let me go back.
So can you please give us a little insight about it?
Which of them?
The color of the urine.
Let's see. I want to see which particular question should I take.
I think this one. Yeah,
this one.
Yeah.
Maintain your urine reddish.
I don't really know that tamsulosin do that. There is a drug in the treatment of
rifampicin.
Yes, rifampicin turns R for R.
Body fluid, yeah.
Yes, and then there is another drug too. When I recall, I'll tell you. But tamsulosin do not do that.
The drug used for Parkinson's disease and also the drug used for treating is a painkiller for
I think it's levodopa, carbidopa.
Yes, carbidopa, levodopa can do that. Sentiment.
That is used to treat pain. It's for pain management in UTI. That one also discovers.
I think is it nitrofurantoin or something?
Right. Yeah.
Nitrofurantoin.
All right. Let's move forward. So let's stick here. All right. So it's not it. As simple as that. Okay. My brother, can we move forward? Professor Ivan Satamils, can we move forward?
Yes, sir. Yes, sir. We can move forward. Thank you.
You are accepting the professor. I say yes. You are your professor. Charlie, thank you for bringing this up. Sometimes the questions dispel somebody's myth. Are you aware? They wouldn't ask, but when you ask, it benefits them, right? Okay. Now, Lizzie, your video is on and pause, and I don't know. Do you want to say something? Okay. To be honest with you, if I ask you guys what you know about beta blockers, guys, are you getting some feedback from me?
No, sir.
Okay. My case are making noise. I most of the times, because I want to live a very bad life, try to hide my case. But the higher I hide them, the higher they scream. It's not easy. Oh.
Please don't hide them. I mean, it's
Tell
all
it
part
mean
of
to
it.
me. So now I think what I have to do is that if I want to go and talk to another woman, I have to carry them on my shoulder. I say, please, I have these troubles with me. Kindly accept me. Eh? Okay. So for beta blockers, majority of people know. What is so common with beta blockers? They normally end with what?
Laws.
Oh,
Oh
no,
Lord,
no.
oh Lord.
We all know it. Let's not pretend we don't know it. We do.
This I also got this trick, which is BBL. So beta blockers, we know BBL. The L is the laws, so BBL just to
Beta blockers, BBL. BBL, beta blockers. Every example be Angelica you come be a
No,
And a
Miss
BBL
Yawa
nye Jamai.
Okay. Yo. Now there is something special about this. I still have my good Nigerian friend in the chat box. He'll say, Masa, I still want to hear that joke in my language. I beg you, BBL is Nigerians are the proponents of BBL. So this one knows further interpretation. All right. Just what about it? How? And oh my God. Linsenye. Papa, please give me space. All right. I quite remember I invited a computer man to create a website for me, and then it got to the stage where I have to upload the videos. He said, bro, I went to the videos. It's not professional crowd. Your dressing, your comment. No, we don't do that. And I'm saying, hey, brah. Don't come spoil my business. So I want professional, no more panel. Would the cast baby na ABB? Would there be free or something bad? There are over 1,000 people on my page. Really, go and check. They are there. It's not really the professionalism per se. They want to gain their knowledge and go away. Phenazopyridine. The pyridine sounds like another drug. Okay, all right,
Pain.
let's.
I think for pain in a UTI or something.
Okay, all right. Let's go on to the beta blockers, and I will need a volunteer. Do I have a volunteer here? Somebody to volunteer? All right, guys. Then I'm ending the class. I'm also stopping my volunteering. I want somebody who is new so that I will teach you genuinely for free.
Yes, I'm here.
Is your name Eunice?
Yes, please.
Hi, Sister Eunice. Nice to meet you.
Nice meeting you, sister.
Okay. So for the beta, there is a noise at your background there. Oh. Okay, I think it's down now. For the beta blockers, just as we had alpha receptors, we also have beta receptors. We have beta 1, beta 2, and beta 3. Most of the time, I don't teach my students the beta 3. The wisdom is that beta 3 is found in adipose tissues. And I will give you the reasons why. And this is all because of something that happens with adrenaline. Okay. I will explain it gradually, and then you will follow, and then you will understand. Beta 1 is mostly, that beta 1 receptors, they are mostly found in the heart. Please, what did I say? Beta 1 is mostly found where?
In the heart.
And then I just said the heart. I just said heart.
Yeah.
Mankasa spine. Mankasa heart and spine. What heart? In the heart. And then beta 2 is found, let's say, in the respiratory system. Beta 2 is found where?
In the
respiratory system.
I think when we talk about the respiratory system, we are just simply talking about the lung. What do you think?
Yes,
So let's use the lung to represent them also. The beta 1 is in the heart, beta 2 is in the lungs. Today, I will give you a little brief before I've seen that there are professionals around. So I'll just give you a brief about the beta 3, but promise me that you'll get rid of it when I'm done. Please, will you get rid of it?
Yes, sir.
Okay.
Yes, sir.
So
Can we also decide not to listen to it to confuse us?
yes, it depends. If you can filter it, that will be perfectly fine for you. So beta 3, like I said, is found in adipose tissue. Now I'm going back to the full physiology and mechanism of action of how the adrenal glands work. There is something in the adrenal glands, adrenaline. When the body is under stress, stress could be anything defined as stress for you. Even at the bleating of a cow or a car sound or whatever, anything can make you release adrenaline because the body is under stress. Now, when adrenaline is released, what adrenaline seeks to achieve is that you will get energy to face whatever you are supposed to face. That is all to it, guys. Adrenaline is just going to make sure you get energy to face whatever the stress is. And that is to take a wise decision whether to fight or to flee away. So it is a fight or flight hormone. That is what adrenaline is going to do. So in a stressful situation, for example, if you've not eaten much, like in the case, those who really know well the pathophysiology of DKA or something we call gluconeogenesis, this is where your wisdom applies. So it goes to the liver, and then whatever the liver has stored, if the liver has glucose, it breaks it down from glycogen, because that's how the liver stores glucose, into glucose. We call it glycolysis. Okay. But if there is not enough glucose there, the body will now utilize other forms of glucose. They will convert your stored amino acid and lipid or lipids or fatty acids or whatever, other types of minerals that is available, and convert them to become glucose. And that is new. So we say new. So gluconeogenesis, the beginning of using something to create something. Gluconeogenesis. You don't need to remember these terms. You promised me already. So when that happens, when you are fasting and there's still something traumatic happening or stressful happening, you still need your defenses to be accurate and you need energy. So this is to ensure that you have enough glucose in your system to be able to either fight or flee. It goes deeper. There is a deeper physiology, but I don't want to bore you with them. But there is something we call glucagon-like peptides. Okay, glucagon GLP, glucagon-like peptides, because that is the work that glucagon should have been doing and all those kind of things. Don't worry about it. So basically, that is what the beta-3 adrenergic receptors do. They help you. That is the reason for adrenaline. Please, can we move on to business and forget about it for now?
Yes, sir. Yes.
Yes. Okay.
Yes, sir.
Yes. So now let's go to our business. We said we have 2 types of beta receptors. Now say I forget it. We have beta 1 and beta 2. Where can the beta 1 be found?
In the
heart.
heart.
The
The
heart.
heart.
And then in the
The
beta
heart
2.
and then the bladder.
The heart.
In the heart.
The beta 2.
In
Lungs.
the
Respiratory system.
Okay. All right. Thank you. When the beta 1 receive adrenaline, it increases the heart rate. It also increases the force of contraction. At the end of the day, your blood pressure is increased. So when I call you to answer the question, this is what you do for me. I'll first ask you, where can the beta 1 receptors be found? You say mostly in the heart. And then when it receives adrenaline, it causes the heart rate to increase and the force of contraction to also increase. In turn, it increases your blood pressure. Or you can make it easy for me. Beta 1s are found in the heart. And then when they receive adrenaline, they cause your blood pressure to increase. That's all. I've not asked you anything else. I've not explained anything else. Don't be too much knowing. Okay.
Hello, boss.
Hi.
Your voice was quite down at that point when you were making your last statement.
What did you hear, my dear?
You said when the adrenaline it in the beta 1, it increases the heart rate, and you mentioned something else.
The force of contraction.
Yes, from
That's
that.
eventually it's increasing the BP. So you can just say it increases the blood pressure.
Okay. All right. Thank
Now, Eunice, unmute again. I'm with you.
You want to go?
Where can we find the beta 2? Raphael, please control your
You
mic.
want to go? So
So the beta 2, you said that it can be found in the lungs.
In the lungs, thank you. What
Yes,
happens is
please.
that when somebody takes the beta 2, or when the beta 2 receives adrenaline, where was I thinking of? When beta 2 receives adrenaline, it causes the bronchial tree or the muscles in the respiratory system to relax. Should I take it again?
Yes, please.
When the beta 2, which is mostly found in the respiratory system or in the lungs, when they receive adrenaline, because the adrenergic receptors, when they receive adrenaline, they cause the bronchial tree to relax, or the muscles in the respiratory system to relax. So, my dear, say it in your own words. Let me see.
Oh, me now.
Yes, you now, my dear.
Okay, so you said the beta 2, when they get to, when the adrenaline gets to the lungs, they help it to relax.
They help you to relax. What
That's
about the
what.
beta 1? Talk to me about beta 1. What do you know about beta 1?
So the beta 1, you said that one is about contraction. So it's caused the heart to increase and the force of contraction to also increase. So basically, there is an increase in BP.
Love
That
it.
was what I heard.
And then
Yeah.
repeat the beta 2 again. Let's see.
And you said so the beta 2, basically, that one is with the lungs.
Okay.
So when the adrenaline gets to, oh, Akusia.
Akusua butre. Mama ye you kakra bi just 2 minutes baby no. Wo de onim units ma me frɛ Fosti wo ho. Now one try.
Sir.
Now hwa akusua mama. Yeah, Fosti.
Sir, please, I'm confused here. Did you say that?
Pass come on, frag, I confused me.
Did you say when when the beta 2 receives adrenaline, it causes the muscles of the muscles in the respiratory system to relax?
No. Now we upe kaya motuum. Yeah, some confusion.
So I was also thinking, I'm confused. I thought maybe when they receive it to cause it to constrict rather.
Don't think about it that way.
Oh, okay.
Tell me something you know about beta 1 receptors.
Beta 1 receptors works, you said it works in the heart, right?
Yeah.
So that one will cause the heart rate to increase.
So see, the language that you are using to say it works in the heart, it is in the heart. It is a receptor. It is a place, a muscle, a site for adrenaline to work, right? So when adrenaline gets there and enter there, then it shows forth those symptoms, right?
Okay.
So that is the wisdom. The wisdom is that when you take the myocardium as a tissue, it has some surface areas that are called beta receptors. It's a receptor site, right? And the type of beta receptors there is which type of beta receptors?
What the beta 1?
Beta 1, because we can one, can make us open investment. Beta 1. Beta 1.
So one trick I know is that you know the heart is 1, so beta 1, and then we have 2 lungs.
We are good though. Like when you talk to them, sooner or later somebody will just craft something and then make the learning fun. Okay, so beta 1 will have the
one heart, and then beta 2, 2
Two
lungs. So
lungs.
2.
It makes sense, don't you think so?
Yes.
It does.
It does. Pa, when now the showers my confusing from searching so okay, so sister Fosti.
Sir.
When adrenaline is released into the system and they get to alpha receptors, they causes the smooth muscles in the alpha system to contract. Now, when they get to the beta receptors, I'm confused because as Abe said, we have different types of the beta receptors.
Yes.
Please, can you talk to me about them, please?
The beta receptors. So you said we have 3 types of the beta receptors. We have the 1, 2, and 3, but we shouldn't concentrate on the 3.
Thank you.
And the 1 is found in the heart, and the 2 is found in the lungs.
3 points.
And one thing I learned is that the beta 1, when it received adrenaline, it causes the heart rate to increase and then the BP to increase. And the beta 2.
Eventually, when the heart rate and then the force of contraction to increase now, okay. So the beta, you said the heart rate increase, the force of contraction increase, so it increases the blood pressure, right?
Yes, please.
And this is a natural mechanism. Also, be a or baby or simi who na makuma to me who na windio
yes
adrenaline na abahama no jimisano. So when adrenaline goes to the heart, then the person's BP goes up. So it's a true phenomenon the men are saying. Sir, it is very true. Physiologically endorsed by Rice Master. What about the beta 2?
That's where my confusion lies. I thought that.
Why explaining the fact, guys? Didn't she explain it initially?
Yeah, she explained it.
Use it. You see, there is a word there. When you mention it, another student will get confused just because you mention it.
Yeah.
Don't say that is where you can say I'm trying to recall. Or I just want to clarify. Don't use it. It's a trick.
Yes, sir, please. I'm trying to clarify.
Okay, this is the second time. Let's go.
So the beta 2, when it receives adrenaline, it will cause the muscles in the respiratory system or the bronchial trees to relax.
Now, to wait, you baby, the confused. They be the same thing. Okay. That is it.
Oh, okay.
Yes. So it's like he's doing 2 different things, isn't it?
Okay.
So this is the whole thing about beta blockers that the NCLEX is going to work on it for you. So the whole thing is that a person is having high blood pressure already. Each time he see a lady pass by, which is normal. It is a natural phenomenon. Or baby atofua. Now we'll go into stressful situations. Basa. You're correct. So so you see, this is a natural mechanism that is happening to an individual. He's already having hypertension, but the slightest bleed of something to fighting him, adrenaline will be released, and the people will go further up. Should we allow this natural mechanism to go on, Sister Faustin?
No, sir.
Okay. So what we will do is that, as usual, we will block the receptor site, right?
Yes, please.
So we go and get a drug called beta what?
Blockers.
Or if you want to mention full name, like if you want to combine words, kind of say.
Beta adrenergic blocker.
So if you're even able to say the name, it means that you understand the physiology.
Yes, please.
Beta adrenergic, because adrenaline in the neighborhood. Receptor. Hey, we are serious. Sikasem na ya won pese wo de usika be mani pa na nka me je usika di papa. Beta adrenergic receptor blockers. So we give a beta blocker. What will happen? Yes, Sister Faustin. And kasem misu mi bi o, and kasem mi bi o, me power sem tina me osano.
So when we give the blocker, it will decrease the heart rate and then the blood pressure.
Good. Then what else? What will happen to the beta 2?
So that will cause, I think, constriction of the beta 2.
It's not even what you think, but that is what is going to happen because it's going to reverse the activity. Adrenaline is not coming. Adrenaline would have caused it to relax. Hey, let me show you a trick. You see, I'm working with you, Faustin. of all my bragging, I was in the military and blah 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 blah. If you decide to work with me, a married man, I tell you I'm able to convince you that I have not seen a woman in my life before, and I trick you and you work with me, then we see a lion thinking that old soldier man is with me. Hey, you see, when we see the lion, this is what is going to happen. I am going to have a loss of adrenaline in the system. Do you know why? Those who believe in God will say God. Those who believe in whatever will say nature, Allah. I don't care. Substitute it. Nature in its own wisdom has made the body set that when you see that frightful situation, they know you have to make decisions. Whether to die for this lady, and not a wishia na what you mo, one na keke baby, I was one be ni da. Omoko be ni, a general be ni, I used to saw on your be ni. Now, then you see a lion, with this lady, then you decide to die or risk your life for this lady. The brain has to work. So what is going to happen is that the adrenal gland will cause your heart to beat fast so that you can have enough blood supply to your brain to think wisely and make choices, whether to fight or to flee. Are you listening, firstly? Joking by teaching.
Sir.
So that is one aspect. Then he knows that even if you will flee or even if you will fight, you need to breathe, isn't it? True or false?
Yes. Okay.
So what will happen to a respiratory tree? To what?
Relax for you to breathe more.
So you see that the two things are in agreement at that time. Oh, natural mechanism. A brukwana na lion. Now the guy ne grab them away, but who catch them? Fly. And this is another situation. Very stressful.
So does it mean that they work, the beta 1 and beta 2 work inversely?
Bro, for on your one hour come there, but yeah, maybe sleep can if you have a year proportional. Keep on the form, or you.
In case they receive the adrenal, this thing, it means that while this one works here, this one works the other.
Yes, and they are all working for you to achieve one thing, either to flee or to fight. You see, it makes sense, pa.
Yes, please.
But you are now going to look at the person's oneness of the situation, say the BP is high, and you are going to give beta blockers. So when you give the beta blockers, we are not going to achieve the natural mechanism, we are going to achieve the negative. So what will happen to the beta ones? Instead of the BP going up, it will go down because you've blocked the site, right? Adrenaline will come and it will not recognize the heart in Ponwakuraho. Then I'll go to the papa to prune him. Boredom. So at that instant, the BP will be down. But the beta 2, what will happen to the respiratory system or the respiratory tree? Explain. Let's go. Firstly.
On track.
Firstly, stay with me. It's about confidence. Okay, stay with me. Don't mind it.
Asking somebody.
Oh, who came in?
I came in, but I didn't know you were asking somebody. I said,
sorry. It's okay. Patience. Would you know? Kumasi, we call it EP. We say Kumasi for patience EP. So we continue with you. I just say, but you know what I mean? Yes, patience need EP. I don't know the relationship. EP. Okay, so firstly, still I need you. I'm using you as a point of contact. That is why, okay?
Okay, sir.
Yes, I love you and I love the way you respond to my questions. That is why I'm using you still.
Yes, sir.
Okay. So you were able to tell me that there is a natural mechanism that happened. Natural mechanism. When adrenaline gets to your heart, your BP goes up. When it gets to your lung, your respiratory tree relaxes, right? But if we block the receptor site of the two of them, just the beta blockers, because when you say beta blockers, you have beta 1, beta 2, beta 3, right?
Yes, please.
So what is going to happen? Even in beta 3, there is a research going on to see whether we can use beta blockers to reduce weight. But then we are discussing, we are tracking it. So beta 1, beta 2. When you block the beta 1 receptors, beta 1 is mostly found in the heart. When you block it, adrenaline will not get there. So the BP will be what?
Decreased.
What about the beta 2? What will happen there?
It will cause vasoconstriction.
To cause vasoconstriction. So in that case, when a person is having asthma, a condition where there is
bronchoconstriction.
Nyabotreni and Konakranka now besa, yes, Yashada, yes, Sabia Momontia Senebusibi, so dear. It's the news. Aye, as son no. We are me for me, and then me mammy or hunting me Jimmy Jimmy Sano, me catch them. Me mammy about class until me Jimmy and me Jimmy Jimmy San come better and capao. Humba now press ano. We now call recording, better yet my market to internet in so. Okay, so firstly, the concept is that if a person is already having asthma, like you said, bronchoconstriction already, do we further still give this drug? Or we should just say, don't give it to people with asthma? What do you think?
No, we don't have to give it.
You don't have to give it. So in that case, beta blockers is contraindicated in what? Asthmatics. Is it easy?
Yes, please.
Can you really answer this question on the NCLEX for me?
Yes, please.
Do they teach you that in your traditional NTCs? Be honest.
No,
they don't. Yes.
No.
And this is a free class. Do you think it is really free as in free, or it is really treasurable?
It is treasurable.
Very.
Okay.
Very, very, very treasurable.
So we don't. You're welcome. Oh, Janine, no. We don't actually give it in people who have asthma and some COPD conditions, chronic obstructive pulmonary disease, because it's obstructed kind of. And we don't care what the NCLEX is asking us. The fact that we are seeing a beta blocker in a patient with asthma, we are alarmed. Now, here is it. Medicine has increased. Somebody is saying that if you were able to study the human body to know that we have a particular type of receptor called beta 1, and you were able to see beta 2, why are you not skilled enough to make a drug specifically for beta 1 and leave another drug specifically for beta 2? Because even in the old lectures, if you remember what Evans asked, we have uroselective and non-uroselective and blah, blah, blah. So they also decided to do some for the beta blockers. They did what we call beta 1 selective. Now, you and I know that beta 1, where can we find beta 1?
From the heart.
So when somebody says cardiac selective beta blocker, which beta blocker is he talking about?
Beta 1.
Does it make sense?
Yes,
Can I now use
yes.
the phrase cardiac selective and it will still make sense to you, right?
Yes.
So when an NCLEX question asks you which of these is a cardiac selective, you know that it's a right postulation, right? It's a right frame. Okay. That will be the general differently. But yes, I don't know. Or the general differently. But just who did be before for who didn't come on chair, but Russian now Mike no it's so who did be a shema why yes no Mike this is so yet a honey jewa papa masumu nyina wonza ye no me sumuti na me tiase na wo de be jima adwene free class. Okay, so a group of researchers came and said, guys, in as much as you are enjoying this class, I'm also delaying the class. When it's exactly 2 hours and 15 minutes, I'm closing the class. We are 1 hour 41 minutes. The rest will be for the paid members, and I won't do anything about it. We be location is mentioned that. Okay, so a group of researchers said, let us try and make a drug that will be cardiac selective. In other words, that will just go to the beta 1 and not work on the beta 2. They were successful. They were able to do such drugs. In fact, I know of 4 of them, and I want to teach you. Guys, look here. What word do you see? Atenolol. In my language, what say bibi atene it means it separated itself from all the others. Oh.
Yes.
So atenolol is selective. It is cardiac. Yes, it's cardiac selective. There are others like bisoprolol, metoprolol, and ismolol. They are all cardiac selective, meaning they are specifically working on the heart and trying not to work on the lungs as well. I created the acronym. How do you pronounce this?
Bam.
Bam, 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 is, I mean, anyhow, that will, so that at least, you see, when I'm learning, what has helped me over the years is that if you have 300 of something and only 2 are different, I will just learn the different ones first, the 2 different ones, and then I'll learn one principle to cover the rest. Guys, you know the trick. So at least let's keep just these 4 as cardiac selective in our mind. But let's continue with the research story. They were able to manufacture one that will work on the beta 1. Just a simple. Are you in class? Thank you. Okay, one that will work specifically on the beta 1. Okay, they did it. But the truth is that as the patients started taking it, they did what we call randomized control trials. Have you heard of that before? RCT.
No, please.
Oh, that means there's no researcher here. Haven't you seen that in research?
I have.
Okay,
I've
so
seen it.
this is it. Like, let's say you have, you want to prove that, let's say smoking, causes tuberculosis. Let's say you want to prove that. So you take a group of population, like let's say 20 people, then 10 of them are those that will smoke, and maybe 10 of them are those that will not smoke, and you see which of them will develop that. So you are doing a trial, and sometimes you blind them. Blind means you don't let anyone know that this is what this one is doing and whatever. Or let's say we have cancer, and we want to say that placebo is not effective for cancer pain. So we will have 10 people, 5 of them will give real morphine, and then the other 5 will give a placebo. But we will tell all of them that we are giving you morphine, then we will see. See, they will all see that we are giving them morphine. But you see that eventually those 5 people who actually receive morphine will say their pain is relieved, but those who receive the placebo will say no, it's not relieved. So that is a trial. You use human subjects and all those control. So that is how, and if you look at how drugs are made into the system, to the pharmacovigilance and all the steps that you have to go through, sometimes it takes about 10 years to get a drug coming to the system. It's not easy. They have to do trials first I think in animals, when they pass animals close to the human, like some primates, those close to our species, then they will now go to volunteers, then they will now go to people who are sick, and now the general population, just to even know the side effect and all that. It's not easy. Okay. So when they did that test, they realized that even though the drugs that they make, like the atenolol, the bisoprolol, the metoprolol, the ismolol, they were very good and cardiac selective. But at higher doses, or as the person kept taking it chronically, then strangely, it started having an effect on the beta 2 again. So even though read with me on the second point, even though some beta blockers are designed to be selective for beta 1 adrenergic receptors in the heart alone, the concept is that no beta blocker is perfectly selective. I mean, at higher doses, some individuals can still have the issue of respiratory issues. So when the NCLEX question asks me about who and what to be careful, based on the nature of the question, I know what to answer. Guys, please, is the beta blockers lesson fully home? Please, do you understand?
Yes,
sir.
Okay, thank you so much. Let's move forward. Now, there is something that I have to tell you about the beta blockers. I wish I had not said it, but I have to. As far as the NCLEX is concerned, when we are going to administer the beta blockers, you know that I told you check the BP and then pause when you started the class, that these are the things you always have to check with the patient receiving an antihypertensive medication. But for the purposes of this class, please, when it comes to beta blockers, make the pause paramount. So you are going to give bisoprolol. The pause is 58. Will you give it?
No.
No, you have to seek advice from the doctor. Okay, guys, are you with me?
Yes.
Now, when somebody is going to hypo, do you know that the person's heart rate increases with hypoglycemia? Are you aware?
Yes.
When a person is taking beta blockers, and we even spoke about some type the beta 3B, but I told you to throw it away, right? And then when I was explaining, it was having some diabetes themes be in it. So what happened is that when a person is on beta blockers, it can mask a bit makata hypoglycemia. So it can mask when the person is actually in hypoglycemia. But this symptom or this thing that I'm teaching you is very dicey. And always I tell students, I wish I had not told you. Because now when I tell them, it makes their selection of answers very difficult. Guys, are you with me?
Yes.
If I had not told them, they are easily going to pick pause. But because I spoke about the sugars, now sometimes they are confused and even want to pick sugars. Please don't be that confused student. Be strong and courageous. When it is about beta blockers, check the pause first before you administer. And beta blockers is contraindicated in asthmatic COPD, sometimes some heart failure patients, until or unless you know that it is perfectly, no, not perfectly, until you know that it is cardiac selective, then you can go ahead and give, but with caution, or with tapering, or with measuring, or with observation. Then you can do that. Then you also have the wisdom that people who are diabetic and on beta blockers, we have to really frequently check their sugar. The reason is that sometimes the beta blockers can mask hypoglycemia symptoms. So instead of the person's heart rate going up, no, because the person has taken beta blocker, no, the heart rate is down. Let's answer this question quickly. Today I was on TikTok. Oh. I had lots of people kakra. Very 15 no share me live, and it was interesting. I was talking about the class. When I finish, I'll go back again and make myself dirty over there. Please partake. It's important. Though I'm joking, but it's for a reason, please. Okay, all right. Enough of the answers. Let's try this question. Now, Eunice Yabu, I wouldn't say we'll be with my doctor and them. What the say you were yes, who come medical school, senior better, I wouldn't say with my doctor. Teacher, Mao, slide 14. Someone got
Typo error. Typo error. Typo error.
Guys, what's the yes, sir?
I was lost at some point. I think my network misbehaved. But I want to clarify because from the response, for the previous question, I see that atenolol is solely cardiac selective. It does not act on the respiratory muscles. Is that so? I just want to be clear.
I also want to be clear on something, and I want an honest answer. Were you doing something that distracted you?
No, I wasn't.
Okay. Angela, what do you think? Answer you will be proud.
I'm honest with you. I didn't get your explanation when I know you were saying something. By the time I could come back, my network fluctuated. By the time I came back,
so it was the network.
Yeah, it wasn't me. So I just wanted to know.
They want to hear.
Yeah, I want to just clarify what you said because you mentioned about where I stopped hearing you was when you mentioned about the researchers that the effect of they created the drug specifically for
and the heart
cardiac
beta 1
beta 1.
Okay. You were paying attention.
So the last question was talking about the medication compatible with asthmatic patients. I didn't answer that question. That's the last question before this one.
Yeah,
I didn't answer, but I saw that the answer is so I just want to clarify for asthmatics.
Before I even spoke about the research, what I did with the presentation was this. And if you're in the pay class, when you go back, you see that I did that. I purposefully jumped. I started with when I spoke about the contraindications, and I was, instead of going to this point, I came down here and spoke about the example
Yes.
of the cardiac selective, and I use the acronym BAME, and I allow people to say BAME or how they want to call it, right?
Yeah.
And this was supposed to be an acronym for bisoprolol, atenolol, metoprolol, and ismolol. Okay, just so that when you get questions that is asking for cardiac selective, you can have an idea about it. Okay, so that was all to that part that you didn't get. And we are saying that even those that are cardiac selective, when you increase the doses or when you use for long, it can still lose their selective nature and have an effect on the body.
On the
Yes.
better to receptor.
Yes.
Okay,
Yes.
can we go to the first question you asked?
But let me give a caution before we move there. I am not a fan of questions and answers. I'm a fan of getting the principle. Okay. So let's see. A patient with asthma is prescribed a beta blocker for hypertension. The nurse understands that certain beta blockers are less likely to exacerbate asthma symptoms. What do you think? What are they? How will you call those kind of beta blockers that are less likely to exacerbate asthma symptoms? Not that they can, but they are less likely.
Cardiac selective.
And then they gave you all of them here are beta blockers. So now it is your duty to now apply the what? The BAME.
Oh yeah. Okay. I get the concept now. I understand it now. Thank you.
Yes, you're welcome.
Thank you.
So sometimes some of the questions, to be honest with you,
I also understand it. Thank you.
share what oh Sister Mary, I feel that your Maya would de. I feel not go with them. Eureka, oh, you found it. Okay. All right. So let's move forward. I'm just trying to teach the free class so that those who have not paid can also get something, because the rest will be paid. We are on slide 33 of 125. Okay. Did we answer this question? Oh.
Yes, we
did.
Okay,
Yes,
let's
we
try this. Let's try this. Don't follow people's answers, so some of the answers are wrong. Mama, mama, Cardiac selective can also be beam. Oh my God. A beam. But what we me cry? Me patcha always ka on send me na me hwese me MTN ye adwuma.
Ɛyɛ adwuma pa.
I love the way people are partaking in a simple exercise. I don't know for you. You may be a very brilliant person, but for me, I agree with that adult concept that when I partake in something, I mean, even if I know already, partaking it kind of create an association for me, because we are humans and we lose things. It doesn't stay forever, trust me. And some of the feedback I've gotten from my students is sometimes when they come to my class, they don't even open book again. It just work. Sometimes when you ask them to mention the name of cardiac selective, they can't tell you, but if you project it, they will know what it is. Yes. So that is the concept. People are choosing one, and I agree with them. Okay, guys, we are done with alpha blockers, beta blockers. Is there any question so far? Our last topic will be the renin-angiotensin-aldosterone system, which I find it difficult teaching all the time. Students don't pay attention. Students have network issues. I don't know. It drains me. But if only students will pay attention, and for once, I plead with them, stay with me. We will not waste my time on this one, because it involves memorization. The lady that I had, was it Eunice? Sister Eunice, are you still here?
Yes, boss, I'm still here.
Okay. So you stay tuned for me. When the time comes and I need you, I will let you show your commitment, okay?
Yes, boss.
Yes, and to be honest with you, one thing that I want my students to know, I don't use questions to disgrace anybody. I'd never do that. what I do is that I am somebody who is mostly moved by discernment. If you ask students who have passed the NCLEX, sometimes I'll be teaching, I can even tell you that I feel you pass, go and write. People say I'm not ready. I say, no, you chat to me privately. I'll encourage you to go and write in the past. Sometimes I don't see things well. So you see me even giving you like, oh, I feel maybe donate something to, like, it's not like I'm a pastor or anything, but I feel there is something about the human mind. If you really move with somebody and the chemistry work, you see that you are able to even predict what the person is going through. Yes. So just so people know that I'm not picking up on them, but genuinely, sometimes wants them to pick something. And for the record, people that I have done this with, like to say angel more no near you more them now, you don't fail, or you guys no don't fail. Whether you believe it or not, I don't care. You don't fail because you answer the questions. And it's not even the same questions you are going to meet on the NCLEX, but that confidence is going to save you. Okay. Any questions on the previous lectures? Okay. Now we're going to start the running.
Hello.
Sabi, please, I have a question.
Okay.
Okay, I also have a question.
Okay.
Asabi, please, I was serving metoprolol to one of my patients, and then I had a heart rate of 57. But the doctor told me that I should give the medication. I questioned the doctor about the heart rate. He said I should still give the medication.
Yes.
And I didn't.
Yeah, go ahead. Go ahead.
Yes, I questioned him like 3 times, and then he confidently told me that I should serve the metoprolol.
Yes. Sometimes it's you did your part as a nurse by accident. It's not toxical. It will bring the heart rate down, but sometimes the doctor is even using it specifically for your blood pressure. And there are instances where even the patient's blood pressure is low. Like there was this patient on my ward whose systolic blood pressure was 90 or 96 or so. And then the diastolic was, I think, 54. But he was on 3 other antihypertensives. And giddy, 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 I picked my keyboard. No, I typed plenty to the doctor with rationale. The doctor didn't mind me. Then I became curious. Then I asked other nurses, this particular doctor, is he the type that when you chat, he reads a number? He said, no. He's even the type that will come to you and talk to you. I said, that was my impression too, but he's not minding me. They said, we don't know. Then I decided to go and read the doctor's note. This patient was having aortic aneurysm. Do you know triple A? Have you heard of triple A before? Abdominal aortic aneurysm.
Yes.
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 Yes. You don't want their BP to go up. There's aggressive management of BP. And the doctor is not damp as I thought he could be or maybe mistaken. Before we even put things to them, we have to be humble first. Now I couldn't even delete the chat that I had sent. The best thing was, doctor, please disregard. Oh, sorry, I was typing to another doctor. Oh, wow. Because I had seen in his notes that we will continue to treat the blood pressure aggressively, right? So they have the other thing. That is what makes them, sometimes you have a whole consultant on the case. They know the heart so well than the little that we've learned about a drug to think we wouldn't give it in a situation. Yeah, so it's a good thing you did and well done. Kudos to your elbows. On the NCLEX, answer the same way that you prove to the doctor. If the doctor said give it, give it. Let the doctor put it into writing, or when you've done it, or before you do it, put it into writing. Dr. Asamoah Boateng was informed at 9 p.m. that client's blood pressure was at pulse was at this level, and then doctor explained that we can still go ahead. What you need, your friend is covering your ass, okay? When you come here, you cover your ass. You're welcome. All right, the other question.
Okay, suppose, and I know most times then my suppers no, and the
Are you
other one,
using earpiece?
Yes, please.
It's making your sound not unis at all.
Okay, maybe I have to change it.
Try it and see. Just take it out and just speak. You see that your sound be Eunice.
Okay. Yes, boss. All right, let me quickly change it. Please, you can go on. Let me change it.
Yeah, but I'll wait for you. Eunice, this is not a paid class. It's a free class. I told you I love you. You think I'm joking? I'll wait for you.
Eddie, from the earpiece back on the white one.
Now the way you feel, why you say be a picky a dinner because you have voice and I'm picky. Just release it
I
and talk.
know. Maybe I will be wasting the rest of the class their time. And
No,
it's
don't care about them. It's a free class. Care about me.
Yes, boss.
You are too good.
More
Hamsi. We're still be at time.
I'm getting jealous.
You have to, my dear, because you see, it's an adult class, and most times, if you ask those who have been with the moderators will tell you, you can never have an Asabi class without a child making noise because we are adult. It's meant to be. So we tolerate each other, we bear with each other, the best that we can. And if you take your time, you're really passionate about somebody, you are not hearing what could be the issue. Could be that he's even using earpiece. And that's why you're so full. Jesus, this punch. I see you wearing earpiece, my dear sister. Take it out in the name of Jesus.
Jesus.
Please, what's your TikTok handle, please?
Kofi Sami.
Okay, thank you.
Please go and follow him. Why? No, it's Kofi.
I used to be rhetorics office, but I changed it. Yeah.
Boss,
So
I'm back.
yes, it's clear now. Eunice, I can hear you.
Yes, boss. Thank you very much. So my question was, apart from the heart rate and then the glucose that is in connection with the beta blockers, and maybe the time of administration, and maybe you can. Okay, so you've already mentioned that grapefruit will be talked about and moving forward, but maybe the time of administration of this medication, can you also enlighten on that for me?
Okay, so yeah, you're welcome. When somebody wants to come to the US as a nurse, what is one thing that will come to you, your mind first, Eunice? What is the first thing that will come to your mind? If a nurse thinks he wants to come to the US, a nurse in Ghana wants to come to the US, what will come to the person's mind first? What do you think?
English.
English.
Yes,
So it's not that CGFNS and other things are not important too. They are all important.
Good evening.
Good evening. But the most important thing is that, and yes, what I mean, or Jan Mike and what will do about team, but I just want to
How queer smart.
So the thing is, beta blockers has a lot of things that can be asked. But I put myself in the shoes of an examiner, which I can be, because I'm studying to be an academician or something like that. And if I'm testing my students, how will I test them? If I pick beta blockers, what will be the most interesting thing to teach them? Even if they are nurses, what should the nurse know about it? I'll rather look at the pulse, the blood pressure, the contraindications before I come to take about whether the person has eaten or not, or the actual time to take it. You can actually take it at any time. But like I said initially, mostly drugs after eating. If they've not contraindicated, they take drugs after eating most of the time. Yeah, so it does not really demand any of those things yet. If those are very weighted stuffs to learn, I will add it to the slide. But if it's not weighted, I will allow the students to go and learn it themselves. So yes, that is the answer I can give to this question. Please, did you hear me?
My second question, yes, I've gotten it. My second question was,
Eunice, you said it's your first time of meeting me.
Yes.
Are you sure?
My first time of joining your. Actually, I think I joined one before that was last year, but that was it. This year, I don't know if you've been holding some of these meetings, but my first time of meeting you this year.
It's not your first time. You've met me before. Why didn't you join my class?
That was like last. No, so you see,
Me trust
the
me trust.
mechanical.
Me pesa bit two blockers be block na koye sembi. Interesting.
Okay, so boss, my question is
The next question, we'll be catching up. My second question, my second question. My third question is, will you join the class?
Yes, I mean, I can see. Hello.
Hi, will you join my class?
Yes.
Why is the
third one.
yes having scratches?
When scratches.
Yes. Is there a challenge? Will you like to talk to me privately?
Yes.
Yes, okay.
Boss.
Let's do that privately. Now go ahead.
Boss. Thank you. So my second question, pregnant mothers, the beta blockers are more the metal, is it the M1
metoprolol.
So assume patients asthmatic and also a pregnant mother. Would you still go in for the metoprolol, or their medication can be changed?
So what is happening with the pharmaceuticals is that when they do the drugs, they have substances that will prepare the drugs. Some of them will preserve the drug. Some of them will make it active in your body. Have you heard or seen this drug before? Amoxicillin. Have you heard of that before? Amoxicillin. It's an antibiotic.
Yeah, yes, boss.
Then somebody will do his own, increase the dosage a little bit, maybe add some claviculate or potassium something to it, and then call it amoxiclav as a trade name. Have you heard of that before?
Yes.
Yes. So they do add things. Sometimes they do even make things better for their drugs. They even sometimes mask. They have some added laboratory because it will cost more if you want to create it as a new drug. However, you can get a patent and do some sort of mixing and other things to diminish some of the drugs with it. Now, the question you ask is a very good question to the prescriber, that will he or she still go ahead and give that? The first concept is about the indication. Why is the person giving the pregnant woman metoprolol? What is the reason? So there are so many things that is happening in the body that will warrant metoprolol. And there are other best or good antihypertensives, especially the central acting one, the beta-dopers and the rest, that can be given in pregnancy as well. And there are other brands of metoprolol that could also be given. So this is a good question to ask the provider that is actually prescribing it. I also know that they do give it, but you have to ask the provider the reasons or why that particular drug of choice. Okay, they know best. But for our knowledge, if the person is asthmatic and all those things, you may not give it. But the concept is that the metoprolol is part of the BAME, the BAME or BAME or whatever. So it's actually cardiac selective a little bit. So despite the fact that the patient could be asthmatic, to some extent, it's less likely, as we answered question on, to cause it. Yeah, Maud.
Asabi, just a correction, and she made mention of the metoprolol as an example of the drugs that we give to the pregnant women, but that is not so. It is rather the labetalol that is given to if she ever saw the M, it might probably be the methyl dopa, but not
the metoprolol.
Thank you.
Girlfriend, yeah, dear. But I mean, I agree with Maud. Labetalol is actually the preferred one. That's why I'm saying that if your doctor is using the metoprolol, then you have to ask the doctor. Okay. Hello?
Yeah, thank you very much for the clarification.
Sorry, my question is, along the way you were saying something about grapefruit. So, and I've not heard anything about that.
You want to go and eat it?
Yeah, I really like it, so I don't know.
Okay, we will talk about it when you join the paid class. That will be with calcium channel blockers, which we will discuss another time.
Okay.
Yeah. Abi, you are in the paid group, right? So we'll meet there. So no problem.
No, I just joined today.
Oh, really? So glad to meet you, Stafilo. And I was doing Philomena Pettinger. You were not angry. You just moved with me. Hey, anyway, oh, Akumapao.
Oh my God.
Oh, Akumapa. Please, are you in Ghana?
No, I'm in Canada.
Me patcho me you know me zell no yeah juma. And all other services necessary yeah juma. And then yes, me person was say me mama say yes was say me
Oh
fellow.
my God.
Okay, nice with you, Mr. Fellow. We will learn, okay?
Okay.
I will make it a task to make sure you pass. But Canadian people, I don't joke with them.
Okay. Thank you.
You're welcome. I will see if I can talk about it. But grapefruit, mostly for calcium channel blockers, make it a point. And then for the statins, have you heard of statins before? Atorvastatin, rosuvastatin, asabistatin, velominovastatin, you know, those kind of statins? You don't take grapefruit. So for these two cardinal drugs, statins and then calcium channel blockers, don't take grapefruit. Okay? From me to you. Okay. First, the woman came a you a babbing. Okay. All right. So, guys, can we move on now? I'm feeling tired. Now, students in Chroma, but you could do 134. So I can't 114 hours a day. Now, one hour now. Students in the corner, one hour. Guys, we've done.
Sabi, please, you are here.
Yeah, we've done 2
Yes.
hours and 40 minutes. We've done 2 hours and 40
Hello, boss.
minutes. Yeah, Mildred.
Please, my network logged me off. About the metoprolol that we're talking about, it's like ask a question, but I don't know whether what she said is similar. I don't know. What I know is that they said metaldopa is appropriate in pregnancy, and then I don't know whether the breastfeeding is part, but forgive me for my pronunciation. So I don't know.
Yeah, somebody responded to that for us. Maud made the distinctions clear. Mildred, your network is speaking like God in a Nigerian or Ghanaian movie. It is echoing something like echolalia. My son. I tell you that kind of thing. So you just reserve the little megabit that has come to your site small by not using most of the speaker and other accessories, and then keep listening. But however, if you miss anything, just let us know. But what you were saying, no, it has been corrected. Like they said labetalol will be preferred. I also mentioned the metadopa, and then Maud actually also confirmed that she thinks
so
there
is
is
the metadopa.
Yes, most likely to be used there. But I'm telling you that a doctor can use metoprolol, and when the doctor uses it, all that you have to do is to ask the doctor, not Asabi. Okay. Guys, can we close and continue another time?
Yes, sir.
Okay.
Yes, sir.
Thank you so much. So I wanna pause here, and then the rest of the class will be the paid section. If you are interested in the way I teach and you would want to learn or prepare for the NCLEX with me, you can contact any of the administrators. However, you got this link, tell that particular person that got you the link here to get you the link to the page or even to the administrators. Okay. I used to put my number here, but it's a bit scary and dicey a little bit, especially with a married man of my caliber who is not stable. It's not good. It's not good. So you just talk to the administrators, and then they will assist you if you want to join the class, and then you join and prepare the class with me. It's not expensive. Let me just mention, it's like $50 a month. I am the only cheapest English reviewer in the whole of USA. The least I heard was $200 a week. So because I know where I'm coming from and the people can't afford, yes. And I'm using amenities, my Zoom can take more than 100, even 1,000 people. We can even stay on forever if we want to, on endless. And it's even recording the class. That is cloud space. I pay for all these things. So that is the only one that you are. And then in the US, time is money. If somebody could go to work and is using that time to teach you, I mean, it's just nice. I'm not saying this to rationalize why I'm charging, but this is an NCLEX class. And then if I'm charging, even if I'm enriching myself, it's none of your business. You need to pass your NCLEX, and that is your family's business. So you just do that, and then you go your way. If you choose to be my friend, fine, you are welcome. If not, just stay to the class. Over 1,000 people on the page. Just come, be focused, do your thing, you pass. Then people don't want to even move from the WhatsApp group again. Then I have to beg them to even move. Like what happening recently. I'm begging people to leave the page. They don't want to go. There is a reason. So we can meet and then talk. Thank you
God
all for
bless
coming.
you. God bless you, sir.
Amen.
Sabi, I have a question.
Asabi, how are you?
I want to
I'm
ask
fine.
for
Yeah, please
the
add to
I
it.
miss you.
$50
It's still
coming
recording.
close
It's still
to Ghana.
recording. Can
Thank
you
you.
stop
Let
the
me stop the
recording?
recording and let me allow my admin to speak first. Please allow my admin. You people have been going to
Okay.
my admin to cause troubles for her.